Good morning to all. Myself, Dr. Suriya Ranjani, Senior Resident from Department of Psychiatry, Sri Lakshminarayana Institute of Medical Science. Psychological tests. There are two types of psychological tests, a projective and a non-projective test. Projective test is based on the philosophy of projections. Projective hypothesis. Projective test focuses on latent or unconscious aspects of personality. When presented with an ambiguous stimulus, such as an ink blot, for which there are an almost unlimited number of responses, the patient responses will reflect fundamental aspects of his or her personality. The ambiguous stimulus is a sort of screen on which the individual projects his or her own needs, thoughts, or conflicts. Different persons have different thoughts, needs, and conflicts, and hence have an widely different responses. Example, responses of schizophrenic patients often reflect a rather bizarre or idiosyncratic view of the world. Projective instruments include Rorschach's test, thematic apperception test, sentence completion, and a human figure drawing test. Concepts about projectives, assumptions. There are the more unstructured the stimuli, the more examiners reveal about their personality. Projection is greater to the stimulus material that is similar to the examinee. Every response provides a meaning for personality analysis. There is an unconscious. Subjects are unaware of these, they disclose. Situational variables, age of the examiner, specific instructions, subtle reinforcement cues, and setting privacy. Inkblot as projective stimuli, the Rorschach, Hermann Rorschach, he was a Swiss psychiatrist and a psychoanalyst. He developed a set of inkblot to measure a unconscious part of the subject's personality. This method have come to be referred as a Rorschach's test, used over the years to help the identify personality, psychotic and neurological disorders. 10 bilaterally symmetrical ink blots on separate cards, 5 black and white, 2 black, white and red, 3 multicolored. About the cards, the card one, subjects often inquire on how they should proceed and questions on what they are allowed to do with the card. Example, turning it or not very significant. Being the first card, it can provide the clues about how subjects tackle a new and a stressful task. It is not, however, a card that is usually difficult for a subject to handle, having readily available proper responses. This is the first card which explains most of the responses bad, butterfly or not, and bad as 35% and butterfly as 29%. The red details of the card too are often as a blood on the most features. Response to them can provide indicators about how likely to manage feelings of anger or a physical harm. This card have a variety of sexual responses. This is a card too. Most of the responses two humans and four-legged animals. And card 3 is typically perceived to contain two humans involved in some interactions and may provide information about how the subject relates with other people. Specifically, response latency may reveal struggling social interactions. Most of the response as human figures, that is 72% gray, and human 76% as gray. Card 4 is notably for its dark color and its shading, for processing difficulties for depressed subjects, and it's generally perceived as a big and sometimes threatening figure. Compounded with the other impression of the subjects being in an inferior position, looking up to it, this serves to inflict a sense of authority. The human or animal content seen in the card is almost invariably classified as male rather than female, and the quality expressed by the subject may indicate attitude towards men and authority. Because of this, card 4 is often called the father card. And bed given as animal hide, skin, and rug, and mostly it is 41% as animal skin and skin rug. Card 5 is an easily elaborated card that is not usually perceived as threatening and typically instigates change of space in the test. After the previous more challenging cards containing a few features that generate concerns or complicate the elaboration, it is the easiest blot to generate a good equality response about it. Beck responds as bad, butterfly, or moth, and mostly 45%, 48% as butterfly and 40% as bad. The texture in the dominant characteristics of card 6, which often elicits association related to interpersonal closeness, it is specifically a sex card. It's likely a sex percepts being reported more frequently than in any other card, even though other cards have a greater variety of commonly seen sexual contents. That is animal height, skin, or rug. Card 7 can be associated with femininity. The human figure is commonly seen and described as a woman or a children and functionally as mother card, where difficult responding may be related to concerns with female figures in the subject's life. Detail is relatively often true, not popularly identified as vagina, which makes also relatable to feminine sexuality in particular. It has a human head or face that is at the top. People often express relief about the card 8, which lets them to relax and respond effectively. Similar to the card 4, it represents a change of phase. However, the card introduces new elaboration difficulties being complex and the first multi-colored card in the set. Therefore, people who find processing complex situations or emotional stimuli distressing or difficulty may be uncomfortable with this card. This card as animal, not a cat or dog, which is pink, and four-legged animal 94% as pink. Characteristics of card 9 is indistinct from form and diffuse and muted chromatic features, creating a general vagueness that is only one popular response and is the frequent of all cards. Having with processing this card may indicate trouble dealing with understanding. Pulls typical of this card. This is as a beck as a human orange and then card 10. It is structurally similar to card 8, but its uncertainty and complexity and reminiscent of the card 9. People who find it difficult to deal with many concurrent stimuli may not particularly like this otherwise pleasant card. Being the latest card, it may provide an opportunity for the subject to sign out and indicating what they feel in their situation is like or what they desire to know. Beck as crab, lobster, spider that is blue, and Piotrkozy as crab and spider that is 37% blue. Next is ink blots, initial administrations. What might be this? The record response or Weberian include time until first response, position of the card, spontaneous statements, non-verbal gestures or body movements, no discussions of examinee's response, testing the limits, asking specific questions to get additional information about the personality functioning, identify confusion, misunderstanding about the task, determine if examinee is able to do better with more testing structures. The scoring category, location, part of the ink blot utilized, entire blot, large or small section, minute detail, white space. Determinants or qualities of ink blot, form, color, shading, and movement. Popularity of the response as frequency of the response. Content as human figure, animal figure, blood, etc. Form can be how accurately examinee's perception matches the corresponding part of ink blot. Generate the hypothesis based on the patterns of the response, recurrent themes, and interrelationships among scoring categories. Whole response, conceptual thought process, form, reality testing, human movement as imagination, color as emotional reactivity. The psychometric properties are first, split half and retest method are not feasible. Interscore reliability with respect to the category is acceptable. Interscore reliability with respect to interpretation is always acceptable. Concurrent validity of 41, Wechsler's Adult Intelligence Scale, and Minnesota Multiphasic Personality Inventory. The Rorschach's inkblot test, still widely used clinical instruments, most frequently used projective test, most frequently taught projective techniques in counseling, psychology programs and practice sites, extensively used as a research instrument, thousands of references in mental measurements yearbook, Exner scoring system, also known as a Rorschach's comprehensive system, standard method for interpreting Rorschach, index derivatives, obsessive style, depression, coping deficient, schizophrenia, coding categories, location, determination, form quality, content, popularity, organization activity, and special scores. Other similar tests are black key picture test, fumage, Holzman inkblot test, and picture arrangement test. Thematic apperception test. Morgan and Murray, as introduced it in 1935, elicit fantasy material from patients in psychoanalysis. A perception, process of projecting a fantasy imagery onto an objective stimuli. 32 cards, 31 black and white with schemes, and describe story. One blank card, that is imagine picture card and tell a related story. Thematic A-perception administration is Murray recommended to use a set of 20 cards, but the number may vary based on the length of the story. Some cards, adult males, some of the adult females, some for both. Some are best used in with children. The themes in the card include success and failure, completion and jealousy, feelings about relationships, aggression and sexuality. Based on the stories told by the examinee, clinicians notes examinee's response to the card, extra test behavior and verbalizations. Analysis of the story requires special training. The interpretation is by Murray's concepts, need determinants of the behavior arising from within the individual, plus the determinants of the behavior arising from within the environment, and the thema is interaction between the need and the press. Indian version is Uma Chowdhury in 1960. It has 13 cards. Basic assumption examinee is identifying with protagonist in the story. Examinee's concerns, hope, fear, and desires are reflected in the protagonist's need and demands and conflicts. That is, the examiner's personality is projected onto the protagonist. Reliability, split half, test, retest, and alternate form reliability measures are not appropriate. Inter rather reliability is acceptable. Validity, conflicting opinions regarding the validity of the assumption and the interpretations. Situational factors as examiner, events just prior to the administration, delivery of instructions, transient internal need states, stimulus pull, desire to fake good or bad. Variation of TAT or Thompson's TAT in 1949 used with African Americans. CAT is child A perception test, pictures of the animals, and CAT H is human instead of animals. Blackie picture test, that is 1950, used Blackie the dog and his family and friends. This is a TAT. This is Blackie test. The black sheep pictures includes 12 picture cards and used by psychoanalysis in the mid of 20th century America and elsewhere to investigate the extent to which the children's personalities were shaped by Freudian psychosexual development. Creator was Gerald in 1947. The depicts a family of cartoon dogs in a normal situation which could be related to psychoanalytic theory. The main character is Blackie, accomplished by a sibling Tippy, mother and father. Blackie's gender was determined by the gender of the test subject. Children were asked to make up a story based in the drawing in the pictures, and the content of these responses are analyzed, indicate the extent of Freudian personality traits such as an anal personality, castration anxiety, or a penis envy. Other picture story test and the picture story test in 1949 used with adolescents. Educational A perception test and the school A perception test measures kids' attitude towards school and learning. And Temas, Hispanic characteristic and urban setting. Other picture story test, make a picture story method in 1952, arrange pictures of the figures on a pictorial background. The A perception personality test in 1990, 8 stimulus cards with recognizable people in everyday settings, more upbeat than a TAT. Multiple choice questions fill in the gap. Words as projective stimuli, semi-structured technique, use of open-ended words, phrases, and sentences provided a framework within which the examinee must operate. Word association and a sentence completion test, two best known examples. Early influences word projection. Galton in 1879 presents a series of words and responses with first word that comes to the mind. Young in 1910, keyword representing possible areas of conflicts. Rosnack free association test in 1910 attempts to standardize responses to specific words. Word association test, Rapport, Gill, and three-part test consisting of 60 words. Basis of evaluation, popularity, response, time, and content, test, retest response. Sentence completion test. Here is an example. Complete the following. I like to. Stems may be general or specific depending on the setting. And obtain information about interests, goals, fears, conflicts, needs, and etc. High degree of face validity, most vulnerable projective test to faking. Rorschach's incomplete sentence blank in Reuters, that is 1950. Most popular 40 incomplete sentences, three levels as high school, college, and adult. Estimates of interscore reliability with respect to scoring categories are in the 90s. Projective figure drawing, quick and easy administration individually or in group. Non-clinicians can administer pencil and paper only. Used to obtain information about the intelligence, neurological interactness, visual motor coordination, cognitive development, and learning disabilities. Questionable use. Human figure drawing test. This test was originally developed by Florence Goodenough in 1926. She used it to supplement the Stanford Binet intelligence test with a non-verbal measure. In 1949, Karen developed a draw a person test. Mashovers draw a person test. Administration as draw a person on a piece of 8.5 into 11 blank white paper. Second drawing of other sex. Tell me a story about the figure. Mashovers draw a person test evaluation criteria. Placement of the figure, right future, left as past, upper right as suppressed part, and optimism, lower part as depression. Facial expressions, large eyes or ears, suspiciousness or paranoid, and light pencil pressure characterize disturbance, and figure size, line quality, symmetry, etc. Interpretation, large shouldered ants, teeth, claw fingers, long arms, fist teeth, unhealthy aggression, short arms as shyness, feminine features such as a long eyelashes, thin waist, darkly colored, sex role confusion, poor integration of the parts, emotional disturbances or psychosis, large head as fantasies, paranoid, narcissistic, intellectually rightedness, anything having to do with an inflated ego, small head, feeling of weakness and intellectual inferiority, long hair as ambivalent sexual fantasies, and tiny eyes as strong visual curiosity. Neck. The neck often represents the connection between the head and the body, and under emphasis may represent one's disharmony between the mind and body, suggest a schizophrenia. Feeling of physical inadequacy. No neck indicate a rigidity, poor control over impulses. Large ears is hypersensitivity to criticism and suspiciousness. Triangle nose as immaturity, pointed nose as possibly acting out tendency, tiny mouth as denial of oral dependent needs, and hands behind the back, possibly the guilt feeling for manual activity. Tiny feet, insecurity, high heel shoes, possible for homosexual tendency, and stick figure, possible for depression. Opposite sex drawn first, conflict with sexual identification, large figure as over ambitious or grandiosity. The advantages are easy to administer, no strict formats, relatively culture free, can assist people with communication problems, and the disadvantage restricted amount of hypothesis can be developed and relatively non-verbal but maybe have some problems during the post-test inquiry. Other figure drawing tests are house tree test by Buck in 1948 and kinetic family drawing test as Burns and Kaufman, picture of everyone in the family doing something, no widely accepted scoring system. And these are my references. Thank you.